And this is kind of one of my typical patients because I've been doing immediate provisionalization for a long time. So my patients come in and they expect to walk out with a tooth. I think it makes perfect sense in the aesthetic zone to make an immediate provisional. I can't tell you that it makes a lot of sense in the molar areas, but some patients now have come to expect this. So this patient came in and she already had the first bicuspid replaced as a immediate provisional. And then she needed to lose the molar because this became symptomatic. For a variety of reasons, she did not want to do it all at once. However, she came in and she had about 8 millimeters of intraferrical bone, and she told me flat out that she wasn't leaving without a tooth. So what was I going to do? Well, I made her a deal. I said, if we got good primary stability, I'll make a provisional. If not, then we'll find a way to bond something in place because she refused to wear a removable appliance. And that's exactly what happened. Here you see the implant in place with the sockets grafted, and then we took a reading, and through careful preparation and a few other methods, able to get very good primary stability. And she walked out with a provisional. It was very short. It's hard to tell here, but it was very short of the occlusal plane. She didn't really care because she left with a tooth. And when she went to smile, there wasn't a dark hole. There was a white blob in place. So I think for single teeth, it's very important. And for immediate provisionalization, it's very important.